Welcome, everyone, and thank you for joining us tonight. Please stand by a few minutes to allow others to join. We will begin shortly. Good evening, and thank you for joining us tonight for our Men's Health webinar. I'm your host, Alicia Solomon. We will start the evening with a few housekeeping issues just to make sure we're all on the same page, and then I'll introduce our speaker. First, your attendance tonight is completely anonymous to other attendees. No one can see your face or hear any of your questions other than the presenter and myself. If you do wish to ask a question, which we greatly encourage, please type it in the chat box at the lower section, of the screen, and we'll be sure to get to all the questions. Our presenter tonight is Dr. Luke Matchin, and he will present on men's health topic of the choice tonight. And the presentation will be about 45 minutes. Dr. Matchin is a graduate of Louisiana State Health Center School of Medicine, located in New Orleans, Louisiana. He completed his urology residency at Texas A&M, Baylor Scott & White in Temple, Texas. His fellowship is in male fertility and sexual medicine and was completed at the Medical College of Wisconsin in Milwaukee, Wisconsin. Dr. Matchin practices at Alliance Urology Specialists located in Greensboro, North Carolina. Dr. Matchin, thank you for joining us this evening. If you could please unmute yourself, I will turn it over to you.
Awesome. Thank you very much for the introduction. Thanks everybody for joining us. Today, we're going to be talking about a topic that's kind of near and dear to my heart, and erectile dysfunction. We'll talk about some of the signs, symptoms, and treatment options out there. All right, we are you guys already know all this stuff. Right, yes. So we'll kind of start at the top. So starting with what exactly is erectile dysfunction, which I'll abbreviate as ED for most of the presentation, including we'll cover some common causes. So what is it? So ED is technically the inability to get or keep an erection hard enough to use it, right? I think a lot of guys envision ED as like a total inability to get an erection, and it certainly is that. But it, like we just said, it can be trouble maintaining. It can be an erection that's not strong enough for you to enjoy it. It is kind of all the above. Unfortunately, it's super common. And you can see some of the stats listed here. There's just under 40 million American men have this to some degree, and it gets more common as we men get older. 40% of guys in their 40s have some degree of ED, 50% of guys in their 50s, 60% in their 60s, and so on and so forth. So it's unfortunately, it's super common. So how do erections work under normal circumstances? So I guess the long and short of it is blood flows in and it doesn't leave. But to elaborate on that a little bit, when our penises get stimulated or aroused, the nerves that cause erections become activated, blood vessels and muscles in our penis dilate, blood flows into the penis, and it compresses the veins that normally would drain blood out of the penis, so that blood can't easily flow out of there. So this causes our blood to get erect, it causes our penis to stay erect. So we'll talk a little bit about some of the common causes, and there are lots of causes, unfortunately, of erectile dysfunction. The three most common ones are vascular, diabetes, and medications. And this makes sense, right? So we just talked about how erectile dysfunction is a blood flow issue. And so it makes sense that anything that negatively affects our blood vessels, like vascular disease, could result in ED. For diabetes, diabetes is a nasty disease process that kind of trashes small blood vessels and nerves. So it makes sense that this would be a big cause. And in terms of medicines, I think there's probably more than 100 medications out there that could at least theoretically result in erectile dysfunction. Erectile dysfunction can also be the result of prostate cancer treatment. And there's a slide later on in this presentation where we'll elaborate a little bit more on that. It's also important to note that while a lot of these sort of general health issues can cause ED, ED can also be the first sign. It can be how some of these general health issues show up as well. And we'll talk a little bit more about that here. So we just kind of mentioned vascular disease or heart disease can be a cause of erectile dysfunction, but also erectile dysfunction can be the first way that heart disease shows up in some men. And I think this slide has some good statistics that I'll just kind of read off to you guys. So symptoms of heart disease may develop within 2 to 3 years of developing erectile dysfunction. ED is an independent risk factor for future heart-related events. And the severity of your erectile function can often be correlated with the severity of your heart disease. And then the second bullet point is erectile dysfunction precedes coronary artery disease symptoms almost 70% of the time. So why does this happen? Basically, kind of the long and short of it is both ED and heart disease can result from a similar disease process. Why we get heart disease is that the arteries that bring blood to our heart can kind of get gunked up with plaque. And as you can see here, the arteries that supply blood to our penis are even smaller than the arteries that supply blood to our heart. So it takes even less plaque to develop like a clinically significant blockage in these penile arteries. And so this is why oftentimes ED can be a precursor to heart disease. It's kind of related to this. A common question is, if I improve my heart health, will that improve my erectile dysfunction? And the honest answer is honestly, probably not, but sometimes getting your heart healthier will help you preserve what you have in terms of your erectile function. And what are the ways to do this? It's kind of all the usual suspects, right? It's diet, it's exercise, lose weight, stop smoking, it's all that. It's exactly what you think it would be. All right, so now we'll talk a little bit about the relationship between erectile dysfunction and low testosterone. So basically, low testosterone is when our bodies, specifically our testicles, just make less than a normal amount of testosterone. You can see some of the medical conditions it's associated with. This list looks very similar to the list we just saw describing causes of ED. Typically, our testosterones peak sometime in our late 20s and then just kind of slowly drift down from there. So you can see some of the stats over here. It's estimated that probably 40% of men, or 4 in 10 men over the age of 45 may have low testosterone. Testosterone plays one of the symptoms of it can be low libido and sometimes erectile dysfunction, since testosterone plays a role in our sexual function as men. Low testosterone is typically diagnosed with 2 sets of labs done in the morning. And if you're diagnosed, there's a lot of treatment options out there. There's injections that you can give yourself either in your butt or your thigh. There's a new kind of subcutaneous injection. There's an intranasal. There are pills now. There's multiple time topical types of testosterone. There are pellets. There's a lot of treatment options. And it wasn't always that way. A lot of these have come online in the last 4 or 5 years. It's important to note, so we just talked about how testosterone plays a role in our sexual function and sometimes can play a role in our ED, but among men that have low testosterone and erectile dysfunction, if we normalize your testosterone, the vast majority of men will still need some sort of treatment for their ED. The relationship between like erectile dysfunction and testosterone it's not linear, it's not one-to-one. All right, so we'll shift gears here to talk a little bit about the relationship between erectile dysfunction and prostate cancer treatment. So ED can often result from prostate cancer treatment. And why this is our anatomy. And that's kind of what these pictures attempt to show you here. A lot of the blood vessels and nerves that help us get erections are just very like intimately associated with our prostate, run right alongside it. And so in the course of prostate cancer treatment, these can become damaged and it can result in ED. This is true with either surgery to remove your prostate. It's also true with radiation treatments. And if it does negatively affect your erections, the negative effects can be temporary or they can be permanent. All right, so now we'll shift gears again to talk about all the different treatment options available for ED. And as you can see, there's more than a few. And I should say up front, ultimately, the best treatment is the one that works the best for you and the one that helps you achieve your goals in the bedroom. So we'll talk about oral medications first. I feel like this is probably where most men start their sort of treatment journey with erectile dysfunction. These work by helping, I guess, they dilate blood vessels in the penis. They help blood flow into your penis. They help blood stay into your penis. You usually take them about an hour before you plan to have sex. You can see some of the side effects listed here. Pretty benign stuff: headache, facial flushing, upset stomach. These tend to be a little bit more common at higher doses of the medications. I think it's important to point out on here under this some cautions bullet point, specifically the nitrates. So nitrates are a component of nitroglycerin, which is a medication for chest pain. It's also a component of a few kind of hard-hitting blood pressure medicines. And when I say caution, so there can be a dangerous interaction where your blood pressure bottoms out. You can have a heart attack. It's no joke. These are the medications overall, they help most guys. So you can see effective 60 to 80% of the time. But then if you go down next to this light bulb, you can see that almost half of men who try these for ED kind of give up on them. And it's either because their effectiveness kind of wanes over time, or just the benefit wasn't enough. It's also important that other bullet point is important to point out that they're less likely to work in men with diabetes. Kind of like we talked about diabetes, just it's a nasty disease process. So the next one we'll talk about are intracavernosal injections. So this is a medication, and usually it's a combination of a few different medicines that you inject directly into your penis whenever you want an erection. Normally it works pretty quickly, like 5 to 15 minutes or so. You can see some of the side effects listed here. Pain, scar tissue buildup, a little collection of blood. Also under that list is prolonged erection. So this is a condition called priapism, and it's a low but real risk with the injections. This is a dangerously long erection that's an emergency, and sometimes it requires more. Sometimes you have to do injections to take it down. Sometimes, even in rare cases, you have to do surgery to help it out. So these work in most men. So probably 85 to 90% of men respond to it. But as you can see here, if you follow these guys out for over the course of the first year of treatment, the dropout rate is pretty significant. And it's because, understandably, most men don't want to stick a needle in their penis whenever they want to have sex, right? I feel like that's reasonable. And so it's estimated that the overall satisfaction rates with this treatment modality, it's probably like 40 to 50%. So the next up is the vacuum erection device. So as you can see in the pictures here, it's kind of a pump device. You put on your penis, you pump it up, it draws blood into your penis, and then there's an elastic band that you slide onto the base of your penis. This probably works a little better than what most guys think, but it's kind of clunky, it can be uncomfortable, it's cumbersome, it's hard to work into your intimate encounter organically. You can see some of the side effects here. We just kind of mentioned some of these: discomfort. You can have bruising. It can sometimes be hard to ejaculate with that elastic band on there. So you can see those listed here. You can see under that bullet point, patient satisfaction rates range from 68 to 80%. I would say that does not match my real life experience, which I think would be considerably lower. And if you jump down to the bottom of the slide next to the light bulb, and there was a particular study that found among men who had erectile dysfunction after having their prostate removed, who were trying to use this for their erectile dysfunction, almost 90%, it didn't work in almost 90% of guys. And I feel like that's probably closer to my real life experience. So the next one we'll talk about is the urethral suppository. And honestly, I think this is in here mostly just for the sake of completeness. I've maybe written one prescription for this in about 10 years or so. So it's a little pellet that you stick down the end of your penis. Normally, it theoretically starts working within 5 or 10 minutes after it dissolves. As you can see here, the success rates are pretty bad. It works about 50% of the time. And then under the side effects, I'll kind of focus on the genital pain. It causes pain in 33% of guys that use it. And at times, this pain can be severe. So it's almost as likely to cause pain as it is to give you an erection. It also can be expensive. It's covered in the VA system, actually. But if you are not in the VA system, it ranges from like 25 to 40 bucks per tablet. So like I said, this is not something that I've found helpful in real life. So the last treatment option out there that we'll talk about is the penile implant. This is a device that's surgically implanted inside of your penis, an incision about like this, where you can get a rigid erection on demand. And we'll talk about each of these things, kind of each of these subheadings in more detail over the next few slides. But in the right patient, the satisfaction rates are excellent. So these are the 3 different Boston Scientific devices available. And starting on the far right, this is a 1-piece Tactra malleable implant. In the middle is the Ambicor, which is a 2-piece inflatable implant. And on the left is the AMS 700, which is a 3-piece inflatable implant. This is the one that we'll spend, I guess, the most time talking about tonight, because I think this is probably the right choice for most guys and gives you the most natural result. So how does it work? So it consists of 3 pieces, like we just talked about. There are paired cylinders that go into into the erectile tissue of the penis. There's a water reservoir that goes deep in your pelvis. And then there's a pump that is implanted down into your scrotum. Whenever you want to, it's all implanted on the inside. So nobody knows it's there if you don't want them to. And then, like we just talked about, and we'll harp on this a few more times, it's designed to most closely mimic a natural erection. So when it's up, but then it's also, when it's down, I think, which is almost equally as important. It's also important to mention that it's the only device out there that comes with a antibiotic coating kind of built in as part of the manufacturing process. And there's some data that shows that it reduces the risk of infection, which is kind of a dreaded risk or complication of these procedures. And then skipping down to the bottom. So I think this isn't some sort of newfangled technology. These have been around for almost 50 years. And I guess there's a long track record. There's a lot of data out there now. We figured out things that work, but I think more importantly, we figured out a lot of things that don't work. All right, so let me see if I can cue this up. This is a video that, it's not really like a teaching tool, but it lets me kind of show you how the device works in kind of an X-ray view. All right, here we go. All right, so we're about to get that X-ray view here where you can see it's struggling over here. Let's see, let's give it a second. Basically, whenever you want an erection, let me see if I can just pause it right there, because I think this kind of shows it. Whenever you want to get an erection, you press the pump, water flows from the reservoir into the cylinders, and it results in a good erection. Let's see if I can skip ahead to there. And then whenever you are done with it, there's a button. I'm not sure if you can see my cursor, but it's right on top of the pump that you press, and it drains the water out of the cylinders back into the reservoir. And your penis is very flaccid there. I think I'm gonna bail on this 'cause it seems to be having some trouble. All right, so it is a surgical procedure. So let's talk about that a little bit. So, like I said, it's usually done in the operating room with you completely asleep, and oftentimes we spend either 0 or 1 nights in the hospital. It's done through a small incision, either just above the penis or just below the penis. And normally you can start using it sometime between 4 and 6 weeks after the surgery. So, and it is, I think the third bullet point here, generally it's surgery in a sensitive area, so there's some discomfort, but usually after a few days, you can kind of start just resuming your normal day-to-day activities. So these are a few just kind of testimonials from patients who've had the implants for a while, and I'll just read these out loud to you. So you can see John on the left, who's had an implant for almost 14 years. It was the first time I had ever had surgery, and honestly, I was nervous. But recovery was pretty easy for me. Having the implant has been really great. I got my life back. On the right, you can see Cliff, a prostate cancer survivor with the implant. What I have come to find out is that you are not alone in this. There's light at the end of the tunnel that may give you and your partner a new outlook on life and your personal relationship. So we'll kind of start, wrapping things up and summarizing things here. So what are the benefits of the implant? So, and we've talked about all this stuff already, but just to kind of recap. So it's proven. It's got a long track record, and the right patients, the satisfaction rates are excellent. We mentioned the antibiotic coating with data showing a lower risk of an infection. It's affordable. So, and I was kind of surprised by how good insurance coverage is, and not every plan, but it's covered under Medicare, and most commercially available insurances cover it. And then I think Boston Scientific also actually has resources that can kind of help you navigate the insurance process too. It's long lasting. This is meant to be a permanent solution to ED. And it's a device. There's a risk that it can break, but the devices have never been better, and they're very durable. So there's data that shows that 94% of them are still in use after 7 years, and just under 90% still in use after 10 years. And then we've mentioned this several times, but just the natural result. Like I said, it's meant to be when it's up, it's up. When it's down, it's down. You can use it whenever you want for as long as you want, and it does not interfere with ejaculation or orgasm. Since it's a surgery, it's important that we talk about the risk. And kind of starting at the top of this, one thing to mention is not all patients are candidates for the surgery. So I have some patients whose hearts aren't healthy enough to have sex to begin with, probably not safe to do the surgery. I have some patients who are on blood thinners that they can't stop safely, probably not safe to do the surgery. I have some patients who have diabetes that's poorly controlled, and those guys probably not safe to do this surgery. Some other risks that we should talk about here. So once we put in the device, there's no backtracking. I tell my patients it's sort of like a knee or hip replacement in that way. Once you have your knee replacement put in, you can't just pull it out. We mentioned this a few times, but since the device, there is a risk that the devices can break down, which could require a revision or replacement surgery. We talked about some of those stats already. 90% of devices still in use after 10 years. Pain, so it's a surgery in sensitive area. So like I said, especially those first few days are pretty sore. There was actually I think a study published recently that found that most men are pain-free or close to it by 2 weeks after the surgery. The last thing that we should talk about is the risk of infection. It's probably between 1% and 2% based on most available data, that if you've got diabetes or a history or a spinal cord injury, those are things that might bump you up closer to that 2%. If you don't, it's probably around 1% or less. So around the time of surgery, you usually get a few different kind of hard-hitting antibiotics through your IV to reduce this risk. And I normally send guys out on at least a few days of an oral antibiotic after the surgery. All right, so I guess in summary, erectile dysfunction, unfortunately, super common and is associated with lots of different kind of overlapping medical conditions. There are a lot of treatment options out there that we talked about them. And the penile, I guess, for the treatment options, like we said, the best treatment is one that works the best for you and helps you reach your goals in the bedroom. For some patients, for the right patients, I should say, penile implants can offer a long-lasting, durable, kind of high satisfaction solution. And then this is also just a plug for the website that you see listed here. This is put together by Boston Scientific, and I think is objectively like a good resource for all things ED. All right, so that's it for me.
And we appreciate you so much, Dr. Matchin. Thank you so much for that thorough presentation. And as you did mention, we do have something called benefits verification, and it is a group dedicated to making sure what your coverages are through your insurance or Medicare, and working together to find solutions so that you can get this surgery if an implant is needed to help with the quality of life, which is always our goal, is to improve that. We do have a few questions for you, Dr. Matchin, and please add them to the chat if you have additional questions, and we will make sure we get to them tonight. The first question we received is, how old is too old for the implant surgery?
So that's a good question. So there's not like an age cutoff per se. As usually as part of the surgery process, you get pre-op clearance from a primary care doctor, cardiologist, but honestly, just, what are your goals? And so I think I guess a relatively recent patient was like in their lower mid 80s, but there's not an age cutoff per se. Like I said, we just make sure that you're healthy enough to undergo the surgery, and if this is in line with your goals, then we can make it happen.
Thank you. The next question I have is, how many years will the implant work?
Sure. So we mentioned a few of, some of these stats earlier, but I mean, typically, like I said, 89% of the device is still in use at 10 years. And I forget the stat at 15 years, but I think it's over 70%. So it is I kind of think of it like when you get it, you're buying it, you're getting like a nice car. And I'll be like, I come from a Toyota family. So like when I get a Toyota, I expect to get 150,000 miles on this thing. And so I said, there are some people who maybe, under normal use, that should take me a while to get to 150,000 miles. There are some people, who put maybe 30,000 miles on a year, and maybe it doesn't last quite as long. But it should last for quite a while.
Thank you. Okay, our next question is, can a man still orgasm after having an implant?
Yes. So that's a good question. So this should not affect your ability to reach orgasm or ejaculate afterwards.
All right, thank you. Let's see. I believe you did answer this one, but if you want to expand on it, it is, how soon can I expect to see results after implant surgery?
Sure. So I guess most patients, I think, are able to use it sometime between like 4 and 6 weeks after. I think probably half of patients around that 4-week mark, and then probably 99% by 6 weeks. And so, I think once you're able to use it, you should see results very quickly.
Okay, this one is more preventative. It says you've talked about ways to correct ED once a man has it, but what can be done to prevent a man from getting ED?
Sure. So most just keeping your body healthy. And, we mentioned, I think we kind of alluded to some of this stuff talking in the slide about like heart, the association of ED with like heart disease. But I think anything that you do to keep your body healthy will have trickle down effects to your genitals, to be quite frank. So, I think healthy diet, exercise, if you're smoking, stop, and if you're not smoking, don't start doing it. But I think mostly it's just exercise regularly. I think all of those things can help you maintain your erectile function for longer.
Okay, the last question, unless we have some more added, is what restrictions will occur after surgery?
Sure. So I guess a few different things, and it's no heavy lifting or strenuous activity, and I guess the duration of time is normally usually around that like 4 week mark. So that's usually after the implant. I'll see you guys back 4 weeks after, and at that point, if everything looks great, you can kind of start doing more of your normal stuff. It would be things like no heavy lifting or strenuous activity. Heavy lifting, kind of arbitrarily defined as 15 pounds, but like if it takes you 2 hands to pick up, you kind of have to strain to do it. Probably too heavy. I think another important activity restriction is not using your penis. So I mean, we mentioned no sex, but just like I said, just not using your penis until you get cleared to do so. Oftentimes you need to avoid, like, showers are okay after a few days, but no bathtubs, hot tubs, swimming pools, rivers, lakes, oceans, until the incisions are completely healed with this thing too, which can, like, it's normally 3 or 4 weeks or so.
Okay, we actually do have one additional question. I guess regarding the different disease states that may lead up to erectile dysfunction, whether it's heart issues, diabetes, etc. Is there any one sector that you see more patients coming from that result in the ED?
So interesting question. I feel like it's very, and I don't know if this answers it directly, it's very rarely like one thing that I see. And often, diabetes is very common, but oftentimes if you got diabetes, like you've got high blood pressure, you've got high cholesterol, so I mean, that diabetes might be the answer to that question, but normally it's just in terms of what causes this or it's usually kind of all the above.
Okay, thank you. I hope you answered the question
Yeah.
fully, but I think you did, because I know circulation issues, of course, is the root, but a lot of other factors play a part.
Sure.
I believe that's the last question. Do you have any additional or closing remarks you'd like to give?
No, I think we mentioned this a few times, but super common. So you're not alone. It gets more common as we get older too. And then like I said, there's a handful of treatment options out there. The best one is the one that works the best for you. So and with any questions, talk to your doctor. We're happy to help.
Thank you very much, Dr. Machin. We appreciate
Thank
your
you.
feedback. We appreciate your enlightenment and definitely your diligence in answering all the questions this evening. Dr. Machin's contact information is on the screen. If you have additional questions for him, please copy it. And this presentation will also be available via recording through your email, so you will be able to listen to it again. And once again, he is available if you have any questions. Thank you again for joining us this evening, and everyone have a great evening.
Thank you.
Thank you.